All right, so welcome everyone. We are so excited that you are here with us today for our, I don't know whether to call it a webinar, presentation, conversation that we've titled Why Every Applied Behavior Analyst Needs a Basic Bestie, more technically engaging with basic research. So I'm very excited to be here with my colleague, Dr. Vanessa Minervini. Before we get started, just want to mention that this series of continuing education events and webinars is put on and sponsored by Emirates College for Advanced Education, as well as ABA UAE, our national chapter. As Dr. Michelle said, we are so excited to have you all here. We want to give you a heads up. You may have noticed that we both have our microphones on. We're both here, we're both talking. We want to orient you a little bit to what today is going to be like. It will probably feel a little bit different than other webinars you've been to. We want this to just be a conversation, a chat between friends. So we have our cups of tea. Well, I have mint tea. What do you have, Vanessa?
I have pumpkin coffee.
Oh, okay. So whether you're drinking your coffee or your tea, we really just want this to be a conversation. So if you have listened to podcasts before, kind of that vibe where we'll be going back and forth, and we would love to hear from you in the chat and the Q&A on the way through. I don't know, Vanessa, are you wearing shoes today? You're
I
a bit,
am wearing boots, yes.
bit
My little
Moji-is, not.
character there is barefoot.
So here's our plan, our little agenda. I like to know where I'm headed when I'm on an adventure, and this is where we're headed today. We'll spend a little bit of time introducing ourselves and getting to know who's here in the audience with us. Talk about why basic research matters. We'll talk about what a basic researcher does, which we are so excited to have a basic researcher with us. Talk about how clinical questions can be answered by basic research. We'll talk about how complex human behavior can be studied in basic research. And then finally, some practical tips. So if you're like me and you're an applied behavior analyst, but maybe you want to engage with the basic research a little bit more, we'll have some actionable items that you might be able to do after we wrap up here today. Anything else to add, Vanessa?
No, that sounds great.
All right, let's figure out who's here. So we have kind of a funny name for our presentation, right? So there's two of us, and in this friendship, I am the applied behavior analyst. So my name is Dr. Sarah Mead Jasperse. I am a BCBA-D. I currently am an assistant professor at Emirates College for Advanced Education in Abu Dhabi in the United Arab Emirates. And I have worked clinically as a behavior analyst from early intervention related to autism spectrum disorder to working on the assessment and treatment of more severe challenging behavior in residential settings, school-based. So really taking what we learned in applied research and applying it clinically. That's really where my passion is. And then we have my basic bestie.
I'm the basic bestie. My name is Dr. Vanessa Minervini. I met Dr. Sarah when we were in grad school together at the University of Florida. After graduating from Florida, I did a postdoctoral fellowship in Texas in the US, and now I'm currently an assistant professor at Creighton University in Nebraska.
So we're going to talk a lot about our friendship today and different places that we've been, but just to kind of orient you to who's applied and who's basic in this relationship.
And it will become obvious as we go on as well.
It will be. So this is the beginning of our story. So we, like Vanessa said, we met at the University of Florida. I arrived in 2011. Vanessa,
Year after I arrived.
so she'd been there for a year already, and she was really welcoming when I got there. And we quickly found that we had a lot of similarities, which we'll talk about in a moment. But we spent 4 years overlapped at the University of Florida, so 2011 to 2015. We have some of our highlights. many days looked like that on the right with Vanessa's car and my car. Uh, any fun memories of that building, Vanessa?
Well, you can tell from the picture that there's not very many windows. So I do remember walking outside after a long day and not knowing if it was going to be light out or dark out or what time of day it was.
The lovely psychology building at the University of Florida. Anyone in the chat recognize that building? So Vanessa and I figured out pretty quickly that we really enjoyed working together. We spent a lot of hours together, both working as well as you can see in that picture, also having some fun. That was a costume party where we were dressed up as the pigeon and the operant chamber. A little shout out to basic research there. So as we got to know each other, we recognized that there were some similarities and differences. So I'll mention some of our similarities, and then Vanessa will chat about some ways that we quickly figured out we had different experiences in research. So we realized pretty quickly that we definitely both had a behavior analytic worldview. We were looking at behaviors and consequences. We had a love for science, really looking at the data and figuring out effects of independent variables on dependent variables. We also figured out we both kept some strange work hours. It was common for us to be working in the middle of the night, so we'd often do that together. During some of those late nights, we figured out that we both loved Mexican food, so a lot of research was done with some Mexican takeout.
That is true. Were you referring to Chewy's takeout there?
Yes, Chewy's. Anyone? I don't know if how regional Chewy's the restaurant is, but man, they have the best Mexican food sauces.
When I moved here,
Yeah.
I looked up if there was a Chewy's to help fuel my late night work, and there's not. The farthest one,
Yeah.
the closest one is 3 hours away.
Lee knows about Chewy's, and Ori or Ari, sorry if I pronounced that wrong, is in Austin where the original is. No way.
Yes.
So yeah, we love science. We got excited about science. We got excited, stayed up way too late, ate too much Mexican food, but figured out that even though our work on a daily basis might look different, like Vanessa's going to talk about, we both had the long-term goal of hopefully, as we would say here, inshallah, changing lives through the science of behavior. So those similarities really is what glued us together from the start. We did have some differences, though,
Yes,
that we
we
still
realized
have.
some differences that we do share. First of all, I wore a lab coat. I think Dr. Sarah sometimes wished she wore a lab coat too.
I was always a little jealous. Like, she was a doctor that got to have a lab coat, and I did not.
Dr. Sarah had Velcro. I'm still not really sure what that was for, and M&Ms as her reinforcers in her pockets. Whereas
Any
I had
no applied behavior analyst, do you know why I had Velcro in my pockets? Let's see in the chat if anyone can guess.
I should have learned that by now, huh?
It just sometimes you're working with PECs and there's an icon and it gets, yeah. Dr. Pam Neidert knows. Yes, and Lee knows. You have FCT cards, you have PECs icons. Exactly, they get stuck in your pocket. But not
Things
as
in my
funny as what
pocket weren't so functional. I mostly ended up with pigeon feathers in my pockets.
can always tell when Vanessa's been walking down the hall.
My subjects, pigeons, relied on me for their food and shelter. And Dr. Sarah's research participants weren't always available. Sometimes they had other obligations outside of session.
We would have friendly arguments all the time about which was more disruptive. If you have to go in on holidays and vacations to feed your research participants, or if potentially you can't collect the data because someone else has something else to do. So that's kind of our overlap, and you can kind of start to see where we had fun together and started learning from each other. So really the University of Florida was only the beginning, kind of capitalized on those similarities and learned through our differences throughout the years. We found quite the glow up, huh, Vanessa?
I like the picture on the right, yes.
The left was a conference we went together in, I think, 2012. And then I think on the right there, 2019 was at a conference in Omaha, right?
Yes, we've been going to conferences together for over 7 years now.
Wow.
Pretty cool to
Uh,
think about.
yeah, I can't wait until we can get back to going to conferences and see people in person. So that's a little bit about us, a little introduction to who we are, our friendship, our kind of professional background. We would like to hear who's with us today. And the way we're going to do that is with a website called Poll Everything. So Dr. Michelle has put a link into the chat. You may need to copy it and paste it. So you go to that website and then we're going to ask you two questions about your role in the delivery of ABA services and then your experience with basic research so we can see who's here today. So I've activated this poll. If you copy and paste the link that Dr. Michelle posted, okay, we can see people. We've got a BCBA-D in the house. And that was not me putting that in there, BCBA. So people are getting in there. So we can see the poll. Can you see that, Vanessa, live?
Yes, I can see
Real
that
time?
changing live. Yes.
Cool.
Oh,
So
we even
don't
have a basic researchers here. That's
Woo!
not me.
You have some colleagues, people on your team. I hope
Hmm.
those basic researchers here end up in the chat too. So don't navigate away from this website because I'm going to ask you two more questions. So we've got a lot of BCBAs so far. Got some behavior technicians, which is fantastic. Happy that you're here. I wish that I had learned about basic research when I was a behavior technician and working in the direct delivery of services. I'm going to give about 5 more seconds or so in case people are getting in. This is cool to see got BCABAs here too. We have all levels of certificants. Special education researchers. We've got some others. Feel free to, if in the chat, if I missed your role, feel free to put it in the chat too. We've still got answers coming in, so I don't want to cut
Yeah,
anyone
let
off
them
yet.
keep going. This is cool. Although I am a little surprised there's not many students in the session today.
It's also, I guess it's possible that students could also be certified or
Oh,
have
sure.
another role. Yeah.
Sure, sure.
And I only made it so you could only pick one option. All right, so I'm going to move on to the next question. So it's the same website, that same link. The next question we are curious about, I'm going to activate this one, is how would you rate your experience with basic research? And everyone is welcome. Everyone from a complete novice, like I'm not really sure what basic research is. Hopefully I'll learn today. All the way up to, I know that we have some experts here in the crowd. So you've conducted basic research or you've taught on that subject. Where do we fall? Vanessa, I want to ask you so much about this distribution and you to analyze the data. Yeah, experts in the
There's
crowd.
another expert. Hi, expert.
That wasn't you, right?
No.
All right, so I think a few answers still coming in. We'll leave it up. This is really, really should let you talk about the data. I'm excited
Well,
with what I see
my
here.
first
Go for it.
reaction is I'm happy to see that there's a number of beginners and advanced beginners because that makes me feel like this talk will be super useful for you. And yeah, that's all I'll say.
Yeah, I'm excited that and it makes me excited to know that people who um, are looking for an entry point, which I think hopefully
Yes.
we'll be able to give people today, and people who are at the intermediate expert level. We would love to see you in the chat because this is all about applied behavior analysts making connections with basic researchers and understanding really how to utilize basic research in their applied work. So please don't be shy. So we've got one more activity on this link. I'm going to show you here. Basic research, experimental analysis of behavior, EAB. We kind of want to understand not only your ranking of kind of your experience with it, but what it means to you. We're going to create a word cloud, if you will. So I'm going to activate one more event here on Poll Everything, and that's a word cloud. So on this one, when you go to it, whatever you think of when you see EAB or basic research, type that in. So pigeons. It's
I'm
probably
so
something
excited to see this one.
that I would type in. Or operant changer. Skinner, I thought that was going to come up. The more people that type that word, the bigger the words will get. So this will be cool to see it live, what we get. A
Yeah,
lot of
this is cool.
Skinner. Laboratories and labs and rats. Classical conditioning, foundation. Ooh, Vanessa, you're going to like that word in a minute.
This is cool. Oh, someone wrote
Intimidating.
intimidating.
So,
Hopefully I can show you that it's actually friendly over here.
yeah. Well, let's see what else we have. Evidence, discrimination. Vanessa, you're. I would put that on there too. You are what I think
Bring it
of
to
when
the
I
word
think of
cloud.
these are great. Research,
This is
operant
cool.
conditioning, sounds, light, definitely. Pigeons. This is cool to see what
It
word
is
came
interesting.
out big.
Look at how large Skinner is compared to everything else.
Yeah, we
That makes
will
sense.
we will mention the man today. All right, I'll leave it up for a few more moments in case folks want to add anything in there. Actually, just leave it up. We can come back to it a little bit later. So feel
Cool.
free to keep putting your words in there. Data, love it. Cause, I assume effect is there somewhere. Found it.
Yeah, I
Effect.
saw effect.
So thanks everyone for participating in that and kind of getting our verbal behavior going about EAB and what it means to you. And our hope is that from those words we'll make it something that is accessible and no longer intimidating if that was one of the words that EAB kind of evoked with you. So obviously the whole 2 hours is about what basic research is, but we wanted to make sure we're kind of all on the same page before we even get out the gates. So Dr. Vanessa, what is basic research? How do you explain it?
Sure. So basic research, basic has some other connotations, but in this connotation, basic means fundamental. In basic research, we're trying to just understand how things work. We're trying to understand and tease apart different variables. And then once we have a better understanding of how something works at a fundamental level, then that information can hopefully be used in application to solve more real world problems.
Yes. And I don't know about everyone else in the crowd, but maybe folks can let me know if you agree. When I first heard about basic research or non-applied research, it was in this context, that non-applied research looks at any behavior and any variable, as opposed to applied research, which would look only at variables which can be effective in improving that specific behavior. Anyone know what the citation is from this one? Am I going?
Drop it in the chat if you know.
Yeah, you get bonus points for this free CEU event. Anyone know what this is from? Some fast fingers in the chat. If you were in the process of typing Beowulf and Risley, you're correct. So actually,
Congratulations.
at the founding, yeah, Dr. Jennifer's there with Beowulf and Risley. She only sent it to us. You can tell everyone, Jennifer. Yes, you were right. So that is really where I started to learn about basic research, but I think that also having some kind of examples to think about would be helpful. So Vanessa, you want to talk about just some kind of context that people can think about?
Sure, absolutely. So some of the types of studies that would be considered basic research are any animal models of a certain behavior. So animal models of impulsivity or animal models of self-injury. But in addition to using animal models, basic research can also use human-based studies in a laboratory setting. So for example, a basic researcher might be interested in how reaction time changes in the presence of distracting stimuli.
So, like in front of a computer, like just like how quickly they can do some mundane task.
Yes, like an identification of a stimulus in the presence of loud sounds or other competing stimuli.
So, as an applied person, that immediately, feel free to type in the chat what it made you think of. But to me, that makes me think reaction time and distractors makes me think of like driving and cell phone.
Yes,
Has that connection been made before?
yeah, that's an excellent point. So in the laboratory side of things and the basic research side of things, we would try to understand how reaction time might change. And does it depend on the type of distractors? And then that could easily be applied to types of distractors while driving, either driving in real life or even taking this as another, before you get to real life, a driving simulator and trying to evaluate more relevant real life types of distractors. Yeah.
Which makes so much sense to study it in the basic lab first before we start studying it in that applied
Sure.
context.
And the more applied you get, the more costly these studies become.
It's a really good point that I hadn't thought of. So this is kind of just to get us oriented. So when we're talking about EAB, basic research, this hopefully will orient people to the kind of general stuff. Vanessa will come back and share some specific examples from her lab. First, though, I'm going to go into a little bit of why does basic research matter. So, I have never done a study with animal participants, and I don't intend to, honestly. Sorry, Vanessa.
Never know.
Never say never. But why does it matter to me? So I thought that was kind of important for us to talk about, as there are many applied behavior analysts here with us. So the central question becomes, why do people who are involved in the delivery of ABA services need to be aware of EAB and basic research? So in other words, why does basic research matter? For me, going back to our essential documents. So if we go to the BCBA task list, our current task list that itemizes everything that a board certified behavior analyst needs to be able to know and do and demonstrate, EAB is right there in the very first section. Move my computer. A4, being able to distinguish between EAB and ABA and clinical demonstrations of behavior analytic interventions. So it's foundational right there. But then if you keep going, we get into all kinds of concepts and principles, respondent, operant conditioning, schedules of reinforcement, operant extinction, stimulus control. And you start thinking like, who taught applied behavior analysts about all of this? We can keep going. Measurement and display, measuring occurrence, looking at different strengths of behavior, graphing data, making cumulative records, designing experiments, distinguishing between IVs and DVs. Most of what we know as applied behavior analysts go back to the big name that we all saw in the word cloud, B.F. Skinner. It's beyond today's presentation to go into the history and nuances. Obviously, there were many other people involved, but the point here being these laboratories with animals is really where it all began. The exciting point is that work is still being done around the world by basic researchers. So now you know one of them. There's Dr. Vanessa with one of her research participants. Who is that, Vanessa?
Well, this pigeon's name was 1078. All of our lab animals do have names, but usually the names are a combination of letters and numbers.
Super sweet picture. And I just pulled, one of Vanessa's early publications that was really a moment for me when I started realizing, if you look at 2013, we'd started to become friends, started to work together. And this was one that really when I started to understand how much her work could impact mine. So Vanessa, what's the 30-second summary
Yeah,
of
I'll
this
just tell you
study?
briefly. This study was designed to see how hard rats would work for food and water at different session durations. And I think I see where you're going with this. It has direct, it can inform applied behavior analysts about variables that affect satiation.
Yeah, absolutely. And that, is a variable that we have to think about all the time, what the motivation is, how much access do clients have to certain reinforcers in terms of how potent they are. And in applied work, it's so messy, right? There's so many variables all the time, as opposed to a lab where you might be able to control more of the variables. So for me, it was, like, teared up, like a moment where realizing what great work you could do in the basic laboratory that could really help us figure out what we were doing in clinical work. Another document in terms of why EAB matters is our ethics code. So if you are a behavior analyst who is certified by the Behavior Analyst Certification Board, this is your code of ethics. And right there at the beginning of section 2 is providing effective treatment. We have to use interventions that are tied to basic behavioral principles based on scientific evidence. And all of that comes, like we just talked about, from the basic lab into the applied world. The ethics, I'm not going to go through the whole code, but goes on to talk about displaying our data in a way that we can determine whether there's an effect with our intervention on the behavior. So there's a lot worked into our ethics code about why basic research matters. I already showed a clip, a little excerpt from this article already, but it also goes back to the founding dimensions of ABA. So back to Beowulf and Risley, 1968. Back to the conceptual system. So instead of having a collection of tricks of random procedures that work, we end up having all of our procedures tie back to those basic principles in a way that ties to the basic research. And then finally, most important for me, is just practical outcomes. Once I started learning how important basic research is to understanding how to determine the efficacy of my interventions, the generality of my interventions, it made it easier to figure out how I should be adjusting intervention parameters, how to be able to differentiate between evidence-based interventions and pseudoscience. So at the end of the day, those are really the outcomes that many of us are looking for in applied work. So as a quick summary of why basic research matters, I hope it means that if you're here, you'll stick around for the rest of the talk because I've convinced you that it matters. It's required by the task list that we understand EAB, that we know basic knowledge of basic principles and processes. It's embedded in our ethics code to provide effective treatment and share our data effectively. And then finally, the practical outcomes for our clients and families. And that's really why we do what we do. Dr. Michelle is convinced. Hopefully more people are too. So Vanessa, tell them like you tell me what you do. Vanessa makes it so easy to understand what a basic researcher does.
Don't set the expectations so high for this audience.
All right.
That's too much pressure on me. So I've worked with a number of species in a laboratory setting. I've worked with mice, rats, monkeys, pigeons, and my work has all generally fallen under the idea of how to make safer, better medications. Currently, my lab works with only rats to do this, and because pain is the #1 reason why people go to a doctor.
Sorry, I was catching up on the chat.
Pain is the #1 reason why people go to a doctor. My lab tries to make safer pain medications. So the current medications that we have for treating pain are opioids. And these opioids are really not effective in some patients, but they have a number of adverse side effects in other patients. For example, it can be hard to stop taking them. They make people feel constipated. And most severely, if too much is taken, they can decrease breathing. And that's a very dangerous side effect. So one of my questions is, what happens if we can mix an opioid with another medication? Now, for about 60 years or so, researchers have tried to find a replacement for opioids, and they have been unsuccessful in those endeavors. So an alternative approach is mixing an opioid with a non-opioid medication. And how would that work? So to illustrate this for you, I'm showing you the effect of the medications on the y-axis and the dose of the opioid on the x-axis. And when an opioid is given, larger and larger doses will relieve pain more and more. However, the adverse effects, such as it's hard to stop taking, constipation, and decreasing breathing, those doses are actually pretty close to the doses that relieve pain. So for this reason, there's an overlap. The dose that relieves pain maximally still has a substantial amount of adverse effects. This is considered a narrow or small therapeutic window that represents that overlap. The question is, if in combination with another non-opioid medication, so a mixture, is pain relief enhanced? And if so, and if the adverse effects are not also enhanced, then we will have successfully increased the therapeutic window. And these mixtures have been not fully studied for treating pain before, but other mixture medications have been successful in treating a cardiovascular disease, for example, or cancer. So the approach, there's some background to using this type of approach.
Okay, can I ask you a bunch of questions?
Please.
So, first of all, you're using all medications that have already been studied and are approved and all of that too. And
Correct.
my computer just, this is perfect that we're chatting because my PowerPoint just quit. Let's open that up. So you're studying all medications that are approved and they're studied. You're just looking at comparing them. So there's not really anything risky in terms of like a new medication, right?
Correct. All these medications have been FDA approved and are currently used to treat something. Sometimes it's not always what I'm proposing to use them for. And moreover, the idea is that we're decreasing risk because in combination, we can use smaller doses of the medications. And really the risk comes in using large doses of medications. So actually, if you go back to my animation, a couple more clicks through.
From there?
No, towards the end, actually. When the window gets wider.
Yeah, okay. We're showing the other way.
Yeah.
Got it.
Okay.
This part where it increases that therapeutic window.
And then click it 2 more times. Okay,
like
now the idea is that by using that mixture, we're using smaller doses, and now we're not overlapping at all with any of the side effects. So this approach is actually would be considered safer or advantageous.
So here's a big question then. What if you, all right, you may have to share the slides.
Okay.
Or I just have to not do that animation again. So can you, I mean, these are humans, right? Can you just ask people about the side effects that they're feeling? What's the, I guess, the benefit of taking it into the basic laboratory?
Sure. And certainly there are pain studies done in humans where they have to rate their degree of pain. And while those studies are important too, sometimes the accuracy of verbal reports is not always the best measure. But moreover, and this is particularly relevant to this audience, not all humans are verbal. Not all humans would be able to describe the type of pain and the degree of pain that they're experiencing. So one of the ways that we can quantify this in a lab type setting is a technique called warm water tail withdrawal. And this is a very straightforward method. The rat gets an injection of its medication, and then we wait usually about 30 minutes. This allows the medication to circulate throughout the body and get to the receptors. Some medications need a shorter time, some would need a longer time, but on average, it's probably about 30 minutes. And then after that 30 minutes, we dip the tail into a warm water bath. And we simply record with a stopwatch how long it takes for the rat to withdraw its tail from that water bath.
Very cool. So you're actually measuring a behavioral response to determine the pain relief. So if it, I'm sure we're going to talk about this next, but if they're willing to kind of keep their tail in for a longer period of time, it would show that they had less discomfort, and you'd be able to measure it that way.
Exactly. So we're asking the animal to detect the stimulus of the water. And if medications can help prevent that detection, that signals to us that that could be a pain relief type of effect in a human. And I'll show you some examples of this. So here on the y-axis, you're looking at degree of pain relief. It's just converted to a percentage here, but basically the short latencies or immediate tail withdrawals represent that they can feel the warm water and they don't like it. And long latencies mean they're leaving their tails in the warm water for the maximum amount of time that we allow. And we cut them off at either 15 or 20 seconds usually. And what you can see across the x-axis is the dose of morphine. Morphine is a classic opioid. It's used to treat pain, usually in a hospital setting, and it's a prototypical opioid. And that's what we see in the rats too. The more and more morphine we give them, the more and more pain relief, or the longer and longer they leave their tails in the warm water. Now the question is what happens when we give them a combination? And the first medication that I tested was ketamine. Now, ketamine is a medication that's been approved to treat depression, and that's only been recently. I believe the early 2020 was when that approval came through. And it has not been used to treat pain, although it is sometimes also used in a hospital setting. For example, patients with severe burns might be administered ketamine while they change their dressings. But really, the research on ketamine as a pain reliever is incomplete. So what I did was mixed morphine with ketamine. And when I did that, you can see that there's a huge leftward shift of the dose response function for morphine alone. That means that in a mixture with ketamine, we're using 10-fold smaller doses of morphine to relieve pain. So that's a huge deal. We're using very small doses of morphine that otherwise would not relieve pain when given by themselves.
That's super cool. So that means that by working with the animals in your laboratory, you're able to tell that there's more pain relief with fewer of those adverse side effects. That's
Yes, so now, so right here we've shown that ketamine can enhance pain relief. Now the next thing we want to know is, does ketamine also enhance the adverse side effects? So one of the side effects that I mentioned earlier is constipation.
Can I ask you one question from the chat first?
Yes.
So Sahil asks if their effects of adaptation would be considered, like once the rat's tail goes into the water, or is the latency too short? Like, is it possible that the tail, I think this is what you're saying, Sahil, like you get in there, you kind of get used to the water's temperature.
That is a possibility. We do control tests for that where they get no medication and just saline, and then we do a follow-up test as well. So great question. That is a concern, and we do check for that in our studies.
Very cool. Keep those questions coming for sure.
Yes.
We'll move on to talking about another side effect, which was constipation, right?
Sure. And like with pain, humans can say, I feel constipated, I don't feel constipated. But we can determine this in a rat, a nonverbal species, through its behavior. And the way that we do this is we just start off by giving the rat a nice big wet meal. And then as soon as it finishes that meal, it gets an injection of the medication that we're studying. And then for the next 6 hours, my very lucky students get to collect, count, and weigh any fecal matter that the rat passes for the rest of the afternoon. So what I'm showing you here is the fecal output on the y-axis. after receiving different injections, either saline or a dose of morphine, which is that same pain reliever we saw earlier. So after getting a saline injection, the rats pass about 14 fecal pellets. And the more and more morphine we give them, the fewer and fewer fecal matter that they pass. So this is a classic constipation effect in the rat, just like a human would verbally report feeling constipated after taking an opioid. Now, what I have not done yet is test the ketamine mixture. But if those data fall to the right of this curve, indicated here in the green shaded region, that would indicate less constipation by the mixture. Or conversely, if the data fall to the left of this curve, indicated by the red region, that would indicate that the mixture causes more constipation. So those data still need to be collected, but that's the approach that we're using.
So that's really cool. So I feel like we're getting like a preview from the Minervini lab.
Yes,
So
you are. This is not published yet.
so the first thing to test was, would you still have the same or better level of pain relief by going to a different type of medication? And you answered yes, and that was very cool. And then now you're going to kind of go through the side effects,
Yes.
kind of one by one. Is that correct?
That's absolutely correct. So if the side effects are also enhanced, then that's not going to be very useful in the long term. But
Yeah.
so far, this type of approach generally works. We just need to confirm that with our data.
I also love how you always make the graphs in a way that I can understand them a little bit better
I'm
with
so
like the
glad.
so on this graph, just so I make sure I understand it, so it would, if you then, let's say that you collect more data in your lab and you're showing that the mixture with the other medication has less constipation, you're going to see a line above it in the green shading there.
Yes, which would mean they're still passing fecal matter even after getting the medication.
Very cool. And is there a specific name for this type of graph? Like I always
Oh,
forget.
I would characterize this as a dose response function because we're looking at how different doses change the output.
Dose response, that's right. So I don't know if anyone else has ever been reading something in a textbook and you've heard dose response and not known what it was and felt like you would never understand it, but Vanessa's here to explain
Well,
it to
this
us.
brings up a good point, actually. Just like it's important to look at different levels of your independent variable, maybe it's frequency, reinforcement, or I'm going to have a hard time coming up with an applied example, but it's important to look at different levels of
For
the
sure.
medication. So that sort of goes hand in hand between the two fields.
So if we, in the applied world, we're looking at, let's say, like a DRO of 5 minutes versus a DRO of 10 minutes in terms of the effect on decreasing challenging behavior, it would be in the same types of interactions that we're looking at, the dosage, if you will. Is that
Yeah,
right?
absolutely. Yes.
Very cool. All right, so that was kind of Vanessa introducing us to her lab, a current line of research that she's studying. Uh, so I don't know how everyone's feeling in the chat. Feel free to let us know your comfort level so far. We can take it up a notch or go over things. Um, yeah, and Sahil or Sahil is saying an applied example would be a parametric analysis of a
Yes.
given intervention.
Yes,
Exactly.
that's the word
In
I was
there,
looking for. Thank you.
in there with the technical terms. Thank you very much. Uh, so I know that sometimes when Vanessa starts talking about her science, I get a little a little overwhelmed, a little intimidated. So we're going to take it back to the clinical realm for a little bit and talk about how some clinical questions can be answered by basic research, and then we'll come back to some more advanced research that Vanessa's been doing. Thanks for the feedback in the chat. That's helpful to know that it's interesting so far.
Agreed.
So my subtitle here is the time to phone a basic bestie moment. So that is me at my desk in my clinic or wherever I'm working being like, I don't know what to do. I have this clinical situation and I kind of know the area that I should be looking in, but I'm sweating. I don't know what to do. And these are the times when I call Vanessa
Never
and
fear, I'm here to help.
she pops up. She's kind of looks like she's wearing a lab coat in that picture. So we're going to go through 3 real life examples of times when I have phoned my basic bestie for help from my clinical setting. So basic bestie scenario number 1. I do want to note that while these are real scenarios, all the details have been changed substantially and all identifying information has been removed. So we've changed settings and genders and ages and all of that, but the important parts about why I might phone a basic bestie are there. So I will paint you a picture. The setting. Residential program for adults with very severe challenging behavior, severe aggression or property destruction or self-injurious behavior. The situation. So I'm working with a 24-year-old woman who is engaging in very severe head banging. So banging her head on the wall, on tables, any surface, her hand to her head, and really some dangerous behavior there. And the medical doctors had prescribed Seroquel to her to be given as needed, or PRN if you're used to reading medical orders. So it was Seroquel as needed. And so the staff, as they were instructed to do, began administering the Seroquel whenever she started hitting her head. So she hits her head and they're like, oh, we got to get the Seroquel into her. So they'd go to the med closet, unlock the med box, and give her the pills of Seroquel. So the clinical question that I started thinking about, and if I'm truthful, worrying about, was whether that woman actually could be engaging in headbanging to access the Seroquel. So we were in a sequence where if we're thinking about like an antecedent behavior consequence, we've got behavior consequence going. So we've got headbanging, Seroquel. So I was a little worried that maybe Seroquel had become a reinforcer and we had a contingency where we were actually reinforcing headbanging by delivering that medication. So what did I ask my basic bestie? Called her up and I said, Vanessa, under what conditions will organisms, humans or otherwise, self-administer Seroquel?
And I said,
they work to get it?
I'm here to help.
She did. She really helped me on this one.
So what I knew already was that there is a strong positive correlation between medications that have reinforcing effects in humans and medications that have reinforcing effects in animals. So in other words, most of the time, with few exceptions, medications that humans will take, animals will take as well. So I went to the literature and did a quick search, and I looked up Seroquel self-administration because self-administration is the main assay that tells us about reinforcing effects of medications. So I did this search and it came back with nothing. And I thought that that was peculiar. And then I realized Seroquel is the branded name of the medication. It turns out quetiapine is the chemical name of the medication. So when I redid my search, I got a hit. And it turns out that yes, animals will take quetiapine or Seroquel. And in this paper, it was rats that had an opportunity to press a lever and then receive an intravenous or IV injection of the Seroquel. And what these researchers were measuring was just how many lever presses they make across a week. And when saline was available for infusion, you can see that these animals do not press very much at all to receive saline. Saline is like nothing, it's like water. So it makes sense that saline would not be a reinforcer. However, when Seroquel was introduced into the syringe, the animals increased their lever press responses. And each of the symbols here represent a different dose of Seroquel. And I mentioned earlier that it's important to study a range of doses. And in this case, it seems like there's no big effective dose. Animals will press for all of those doses of Seroquel. So this is evidence of a reinforcing effect of Seroquel.
can I ask you a basic question before I bring it back to clinical?
Yes.
Is this, so you said these were rodents, right? Or it says there.
Rats, yes.
Is that a lot, like a lot of lever presses? Like, would they work really hard for Seroquel, or is that, what's
Yeah,
your kind of
good
judgment call
point.
on that?
I would say overall, that's not very many presses. Certainly, there's other medications that would engender much higher amount of lever presses or rate of responding. So here, this is a relatively weak reinforcer, I would say.
Okay. But still a little
But a
bit of
reinforcer
evidence that,
nonetheless.
yeah.
Yes. If this
So
Seroquel was not a reinforcer at all, we should see no difference between Seroquel and saline.
it would overlap with the saline.
Mhm.
Yeah, so my basic bestie found these data for me, explained them as this to me, and then that it kind of confirmed my concern a little bit that we did have a possibility, whether we're giving someone access to Seroquel or giving them access to some other reinforcer right after they engage in self-injurious behavior, that can be a problem. So a PRN delivery of a medication, like here specifically Seroquel, after the self-injurious behavior potentially could shape up a reinforcing effect could emerge. So these were data kind of went back to the clinical team with. Certainly we're not going to override a medical order by an MD for a medication. We're going to keep following that. But important information for an applied behavior analyst to know how medications can interact with behavior, what medications can be reinforcers, and what we might want to be looking at to make sure that we are not delivering a medication in a way that actually increases the behavior instead of decreasing, which is what the order really was to do. So this is kind of one of my most salient moments of being like, I am so thankful for having a basic bestie.
I remember this very clearly as well.
I think I may have been kind of panicked on the phone when I called. So feel free, Dr. Michelle put the actual link to the article. If you're, now that you've been introduced to it through Vanessa, you want to try to kind of wade through it on your own, you can follow that link to get a copy of the article. So that was basic bestie scenario number 1. Phone a basic bestie scenario number 2. Again, the identifying details have been changed. But this setting, when I paint the picture, this is an early intervention program for children with autism spectrum disorder. So we're teaching very early skills that are going to be foundational for more advanced skills that our clients are learning later on. I was working with a 4-year-old boy. He had made tons of progress, mastered many early learner school readiness skills, and we were getting ready to actually look at transitioning into typical school, into a classroom with age-matched peers. But I knew a problem that I had was that he was currently earning reinforcement on a continuous schedule. So, you know, we give one instruction, he does one response, he gets one reinforcer. That's not real life when you start transitioning into a school setting when you're now one student of many. So I knew that to do best by this client, we had to fade that before he was ready to transition. So I wanted to fade to a variable ratio schedule in advance of that transition to a general education classroom. So that I had a ton of clinical questions here. We won't go over all of them. I wanted to know how to pick a variable ratio schedule. For example, do I start with a VR3, a VR5? Once I picked it, do I have to fade it in a certain way? And then how do I actually determine how many responses should be required for each reinforcer? I would love to hear in the chat if you are an applied person, a clinical person, and you have programming for your clients on a VR3, VR5, VR10 schedule. How do you determine on each one? So I guess this is confession time, even though it's recording. Previously, I just kind of guessed, right? So we're in a VR3, so I'm like, well, it's been about 3 responses. I'll give a reinforcer. Okay, thank you. There's some honest people in the chat. I'm not the only one. And it wasn't until I met Vanessa that I was like, There's probably a way that I should do this that's a little more anchored in science than just my potentially biased guessing. So of all these questions, I asked my basic bestie, how do you program VR schedules correctly? She does it all the time in her research. So I wanted to know, I didn't think that she sat in there with the pigeons being like, I think that was about 10 packs the reinforcer.
And I'm here
So,
to help.
tell us what you do.
Okay, so first I want to give you a little backstory. VR schedules are now programmed based on the same type of equation that was used to program VI schedules. So in the olden days, much preceding me, I don't want to guess the years, maybe 50s, 60s. The way that researchers programmed VI schedules was they had a long tape and then they would hole punch the tape at various and unpredictable points along the way. And each hole punch would set up the next reinforcer. However, one limitation is that animals became very sensitive to the sounds that the tape made, and they could predict when the next reinforcer would be set up. And that defeats the purpose of a variable schedule. It's supposed to be unpredictable. And so because of that limitation in the equipment at that time, there was a paper published in 1962 with a mathematical equation to develop the values for the VI schedules. And the key here is that it's not an arithmetic mean, it's a constant probability. So that overall there's a constant probability for all of those values, and then you have the overall schedule mean. Okay. This same equation is still used today for VI schedules, but also that same principle can be applied to picking the ratios for VR schedules. And the way we would do this is with our computer software. Uh-oh.
It's every time we go to animations. Hang on. While that's reopening, do you want to tell us a little? So this was news to me too when I learned about what you do in your laboratory, about how you program your chambers and all of that. I did not know that you needed to know programming in order to be a basic researcher.
Sure, that fits well here. I'll give the little background for that. So we have our operant chambers, and our operant chambers are all controlled by a computer. So there's computer code in the computer code that is executed that tells the chambers what levers to turn on, what lights to turn on, when to give a food pellet, but also counts when the rat presses the lever or when the rat collects its food pellet. So all of the outputs, like the lights and the signals, are controlled by the computer, as well as all of the inputs, the responses, and the timing are all controlled by the computer. And so to get the computer to do this, we need to be able to write code that the computer understands. One of the coding programs that we use has a command in it to come up with that constant probability distribution. So the computer code is already set to go and it will execute that equation. What we need to plug in.
I'm gonna leave. Is it okay if I leave it without the animations for a second and just show the? I'll share it back after these two slides.
Yeah, absolutely. I didn't know if they could see this or not right now. So, okay, that's good. So the two pieces of information that the researcher needs to plug in for the equation to work properly and for the code to work properly is a list of some possible ratio values. And it turns out it doesn't matter how many you have or what those values are. But what is important is what you want your mean value to be for that list. Okay, so we have a list of possible values, and then let's say we want a variable ratio 10. The key part of this code is making sure you have that 10 in place. So I'll just give you a couple of examples. So if I have a list of 5, 10, and 15, I have a list of these three values, but if I want the average to be a constant probability at a mean of 10, the computer code will spit out 1.89, 7.2, 20.98. And we would round up to the nearest whole number, and then we would randomize that sequence. So we would pick one, then another, and then repeat the list. I said it doesn't matter how many or what the values are for your list, and that's the example on the bottom. I plugged in the numbers 1 through 10. Again, I want a constant probability with a mean of 10, and you can see on the right-hand side the values that the equation is able to execute. Again, we would randomize this list. Here I'm showing it in ascending order from low to high, but it would be important to randomize this and then repeat the list once you go through it once.
Okay, perfect. So we're all ready to program our operant chambers, right? Just kidding. Even that is above my head to know how to program like that. But what I did learn from Vanessa was that we can do better than just guessing on our own and bringing our own kind of biases into our fake random list for VR schedules. So for those of us who cannot code operant chambers, another option would be to try something like random.org. So Dr. Michelle just dropped that in the chat. So if you go to random.org, you scroll down until you get to the numbers section, and then you can go to integer set generator. And that could be a way that if you're a BCBA, you could program a VR schedule in a more properly random sort of way. So if I'm looking for around a VR10, I might generate one set of, I want one list with 20 numbers in it and between 1 and 20. So it's going to end up hopefully sort of averaging around 10. You unselect sort the numbers in ascending order because we want them to come in a random order. So I set this up with these parameters, and this is the list that was generated. So if I'm trying to do a VR10, the first reinforcer would come after 19 responses, then after 1, then after 7, then after 16. So it just gives us a way in a clinical setting to have some more randomness put into our schedules rather than just guessing along the way. Are we good doing it like that, Vanessa?
That looks good. I approve.
Is that good enough?
Yes, that is
Okay.
definitely good enough.
Is it better than just pretending?
Absolutely. This is a lot better. And notice how the distribution has some smaller values right next to some larger values. And that's important. That's what the equation aims to do that I showed earlier.
Awesome. So that was our Phona Basic Bestie scenario number 2. So again, if you have any questions for Vanessa about that, feel free to put them in the chat along the way. Or if you could think of ways that this might be useful in your own clinical or applied work, feel free to drop them in. All right, we'll move on to Basic Bestie scenario number 3 though. So this setting was a Master of Science in ABA program at a university. Well, note here that no details have been changed. I really did this. This is about me. So we're not talking about a client. We're talking about my situation. Here's the situation. In an effort to provide my students with frequent feedback, I was grading hundreds of assignments on a weekly basis. So we know that many opportunities to respond and many opportunities for very frequent and feedback that comes quickly after the response results in good acquisition. So I tried to do that. I once on a teaching evaluation got a negative comment telling me that sometimes I take almost a week to turn around the grading. So I was like, I need some data before I just go with this qualitative statement. I need some data about what I'm actually doing on a daily, weekly basis in terms of my grading. So I wanted to visually analyze a couple of things. I wanted to know what my standard turnaround time was. So was I really hitting a week? That was my goal. If students turned in some assignment, I wanted to try my best to get it back to them within a week. So I wanted to be able to see if I was doing that across a semester. I wanted to know, maybe more morbid curiosity, but exactly how many assignments I was grading each week. And I wanted to know what my patterns of grading looked like. I was just kind of curious to know, was it continuous? Did I have some breaks? How was I doing? So the clinical question really was just, how do I best graph my own data in order to answer my questions. So this one, I didn't ask my basic bestie beforehand. I had learned enough from her across the years to see if I could try it on my own. So I made some graphs, and what I want her to do here today is actually just kind of analyze my data and coach me on how I could improve these graphs to answer my questions. Again, I'm looking at turnaround time, looking at how many I'm grading on a weekly basis, and I'm looking at kind of my patterns of grading. So instead of having Vanessa fly 17 hours and 20 minutes from Omaha to Abu Dhabi, we get to do it live here today.
I'm here to
So
help.
thank you. So Vanessa, this is a cumulative record of my graded assignments from fall 2019. So looking at the total number of assignments I've graded thus far in the semester across days in the fall semester. So starting first day of the semester, and I collected data all the way up to the week right before finals. So I guess tell me how you'd analyze my data and if there's anything that I might be able to do differently in terms of graphing or in terms of my grading. I'm a little
Okay,
scared.
so overall, the first pattern that pops out to me on this cumulative record is that there's a nice diagonal line across the page. So that indicates to me that you were keeping a relatively steady pace throughout the semester. So that looks good. Something else that's interesting here that I see is you almost get a characteristic break and run pattern that we see in rats or other animals responding under fixed ratio schedules. So you have some periods of pausing and then an increase, and then some pausing and then an increase. And so it looks like your grading was maintained by fixed ratio contingencies.
So like I would uh, do all of my grading at once, get the reinforcer of having my inbox be empty, and then take my post reinforcement pause.
That makes perfect sense. Yes. So
That's
maybe
definitely
this was a
exactly what I was
negative
doing.
reinforcement FR schedule.
Yeah, I would agree.
I also see a relatively long pause right before November started, so at the end of October a couple years ago, and I wonder if perhaps there was a holiday at that point.
Like maybe fall break or something fell
Yeah,
then.
that one
So
sticks out.
it either could be, I see what you're looking at. So that could mean two things, right? It could either mean, you know, nothing else came in, so I had nothing to do. So maybe there was a break and I wasn't getting any assignments in. Or it could mean I just took my own break from grading, right?
Your
like
own
I just didn't.
grading holiday.
I'll have to look at my calendar to see one or the other. Uh, cool. That was pretty cool to see you actually describe my patterns of grading from just looking at it. Anything else on this graph? I have two more to show you.
Let's see some more data.
Okay. So I also graphed the total number of assignments waiting to be graded, or what was ungraded on that day. So on the y-axis is essentially how many were in my to-do pile, and then across all the days on the x-axis. So, and again, the same time frame going from the start of the semester up until right before finals. So what do you think about these? Critique my graph and my behavior.
Okay, so I do see a pattern here that every time there's a peak or a high in the total assignments ungraded, you get that down very low almost immediately. So that suggests also to me, along with the last graph, that maybe there's some negative reinforcement here. There's a lot waited to be graded. You grade them all at once to remove that aversive stimulus.
Mm-hmm. Which makes me, I don't know, maybe other professors in the crowd can tell me, like, do you think this is unrelated to graphing, but I wonder if it's healthier to do like a little bit at a time or to just like, I want to get rid of it and drop down. Like, I'm guessing I really enjoyed those time periods when it was down to zero and I had nothing to grade on those days.
Well, and one thing this graph can't tell us is your due dates for your assignments. So are they high
Yeah,
because the due dates are all at the same time, or are they
yeah.
high because you have allowed them to pile up? We don't know from this graph.
Yeah, it looks, wait, kind of like October, the end of October, when I took that grading holiday. It might have
Oh
been just me
yeah.
taking a grading holiday because that has like four, it looks like four due dates stacked on each other. Does that make
I see
sense?
that, yeah.
Yeah, and there's cool comments in the chats coming through, like maybe the same thing, like post reinforcement pause. Is it possible that I'm like pausing too long? Like I I I take it too seriously.
Uh,
Hmm. Okay, I have one more graph
yeah,
from
let's
this
see it.
situation. So this was across the whole semester, now looking at kind of categories of how long it took me to grade assignments and to return them back. So on the y-axis, looking at the total number of assignments, and then each of the bars is a category. So the first bar, around 500, 525 assignments, I got those back within 0 to 5 days. Around 600, between 6 and 7, and then so forth, 8 to 14, and then 15 plus. So what do you think about those?
So the very first thing I see is that this distribution is skewed to the left. And that is good when it comes to returning assignments because the more immediate the feedback is, we know that it's better to have immediate feedback than delayed feedback. So pretty much the vast majority of your assignments are returned within a week, if not much sooner. And only a small amount of your assignments are returned longer than a week. So one thing this graph doesn't tell us is whether the assignments that take you longer to return maybe correspond with a period of time where you have a lot of assignments waiting to be returned. But another possibility is that the assignments that take you longer to return require a larger response effort in terms of feedback. So like a quiz, maybe it's
Yeah,
something you can grade quickly, but if you're going to grade any written work or research-based work, that's probably going to
yeah.
require more time and effort.
Which is unfortunate that I'm not able to see that on this graph because that's totally true. So here an assignment is an assignment. So whether it was a daily reading quiz that's just quick tick tick tick, or giving feedback on a draft of a long paper, those are all one assignment. If
Mm.
I did this again, do you have any ideas about how I could show the data to actually separate those things out?
I think if it was me, I would just split this up into a top panel and a bottom panel and have
Mm.
like quizzes versus written work, just two broad categories.
Yeah. I was thinking about trying to do like bars next to each other, like split it, but that would probably be too messy, huh?
That wouldn't be bad. That would not be bad,
Okay.
but I like two panels. And it would be that two panels would allow you to compare the shape that the distribution makes for the different types of
Oh,
assignments.
yeah, that would be cool. Well, thank you for giving me a live review of my data. So hopefully that wasn't too self-indulgent for everyone, but just an example of how basic research can inform our own self-management and kind of how we look at our own behavior in whatever profession we have. I count on Vanessa all the time of how would she look at this situation. So as a little summary, we have about 40 minutes left. So a summary of just how some clinical questions can be answered by basic research. We talked about interactions between behavior and medication. So how can we proceed with a behavior intervention once a medication has been prescribed? Scheduling reinforcement effectively. How can basic research inform how we design schedules of reinforcement? And then displaying data. So how can basic research inform how we interpret and share our findings? I think that in a lot of applied work, the cumulative record is underused, but when you have a friend like Vanessa, it comes to mind more often that there are ways that we could look at cumulative responses. Now we've been in the clinical world, and we promised that we would get back to Vanessa's lab. So if you are here to see some cool basic research, that is what's coming next. And Vanessa's going to talk us through how complex human behavior can be studied in basic research. There are more animations in these slides. That's possible they'll quit again, but we'll keep our conversation going. All right. Complex human behavior. It's a challenge, Vanessa. How do you look at that stuff in a lab?
So the data that I showed you earlier was based on very simple types of behaviors. I showed you the tail withdrawal reflex. I showed you the physiological behavior of passing feces, but basic research can also help understand complex behaviors as well. So two types of complex human behaviors are impulsivity and memory. So those are complex behavioral processes. But we can break those down and study them with special paradigms. So impulsivity is studied by a choice method called delay discounting, which I'll tell you more about, and I'll animate it for you. And memory, which is studied by using a delayed matching to sample procedure. So we can objectively determine what these processes mean.
Like, baffles me every time that you can study things like impulsivity and memory in such a fundamental way. So talk us through it. We're doing impulsivity first, right?
Impulsivity first, yes.
Okay.
Okay, there's a number of different ways to arrange a choice task to look at impulsivity. I'll tell you about one today. This is one form of delay discounting. And in this setup, the monkey has a choice between a small amount of food and a large amount of food. And the monkey is very smart. Just like we would choose a larger amount of money over a smaller amount of money, the monkey easily chooses the large amount of food by pressing the lever. Now, however, if we impose a delay so that the monkey has to wait to receive that large amount of food, eventually there'll be a point where he switches over and instead prefers the small but immediately available amount of food. We can graph these choices by graphing the percent choice for the larger amount as a function of the delay to that larger amount of food across the x-axis. So when there's no delay and they're both available immediately, the monkey 100% of the time prefers the larger amount. But that
smart monkey.
Smart monkey, yes. But that choice decreases, and at a delay of 180 seconds, the monkey instead prefers the one pellet of food that's available immediately. So the value there is on immediacy and not on amount anymore. Now,
like they would rather have, like, even though the red one is bigger, they're not interested in waiting that long. They'd rather just have a little bit right now.
Yes, that additional delay devalues or makes the larger amount less preferred.
That makes sense. Same idea as, like, if I could have like a little bit of money or have to wait like 5 years for some money. Yeah. Okay.
Yes, exactly. So this experiment was conducted all under baseline conditions, but what we would do next is try to identify variables or conditions that could shift choice. So if choice is shifted to the right of this function, that would indicate that the intervention made the subject less impulsive. And researchers have been trying to find medications that can decrease impulsivity, make them less impulsive. And one such medication is stimulant medications like Concerta for individuals that have attention deficit disorder, ADD, or ADHD. So this procedure has been useful there. On the flip side of things, we'd also want to know if there's any interventions that make subjects more impulsive. So this would be considered an adverse effect of an intervention. And that would be if the data were falling to the left of this function. And there is some medications that are used to treat various conditions. For example, seasickness, that medication makes subjects more impulsive so that they pick the smaller amount sooner and sooner.
No way. I had no idea that that was a side effect.
Yeah.
Wait, okay. So you talked about medication as an intervention, which makes sense because you study behavioral pharmacology. But we could also, is it possible that we also, now I guess I'm trying to pull it a little bit out of the basic lab, could we look at interventions that are not medication that could try to shift it to that green part with less impulsivity? Like, could we, I don't know if I'm using the right words, but kind of do a baseline assessment with this task and then maybe teach someone, while you're waiting, play with this maybe less preferred toy or do something during the delay to keep you distracted. Am I on the right track with that? That
Yes.
we also can shift it around with even more behavioral and less medication
Yes,
interventions?
absolutely. These interventions or these manipulations do not have to be medications. They can be behavioral manipulations as well. And those are of interest to basic researchers too.
Very cool. So if we actually, now that, again, it was always a little intimidating to read graphs about delay discounting, but hopefully with the way that Vanessa explained it today, if you are interested in this type of impulsivity research, I think the way that you show these graphs makes so much sense to me of what am I looking for? Am I looking for a line to move to that green part or a problem if it moves down to the red? So again, if you have questions about impulsivity and evaluating that in the lab, feel free to put it in the chat. Just want to make sure everyone remembers, if you want us to be able to see the chat, make sure you send to everyone. If you send it to all attendees, you can all read it, but Vanessa and I can't. So if you want us to read it, if you have questions, send to everyone. And then Vanessa, you have one more complex human
Yes, I
behavior,
want to
right?
talk
And
about
that's
memory
memory.
too. Oh, wait, we have a question really quick.
Dr. Jennifer, of whether, yeah, let's go back to impulsivity. The models of impulsivity always involve a concurrent choice. Oh, I never thought about
Yes.
that.
Yes, generally they do involve a choice between two or more alternatives. What can differ from model to model is perhaps instead of the a delay being just steadily increased, the delay could be adjusted based on the choices that they're making. So if they choose too many of the larger amount, then that delay would grow. If they choose too many of the smaller amount, then that delay would shrink. And then some other variations are the amounts can actually be adjusted while the delays remain constant. But yes, overall, it's generally a choice between two or more alternatives.
Uh, can we go down a small rabbit hole before we move on to
Yeah,
memory?
absolutely.
So this was also when I was first learning about delay discounting. I actually didn't know about the animal research to begin with, and I learned about it in the kind of paradigm in a lab where a human is being given options, right? So you say, if you could, do you want, we have people around the world, $1, 1 dirham, 1 euro. Do you want one today or do you want 10 tomorrow? And I have to think about it and I say, I want $10 tomorrow. But I'm not actually getting it, right? It's like a hypothetical task. Is that correct? Okay.
Yes.
So I was always like, ugh, we're not measuring real behavior. Like this, I don't know if I should believe this. Like this is all hypothetical. So it's so cool that you can actually do this. You're not just asking the monkey what they think they want, right? You're
We
actually
follow
running this
through.
out.
Yes, we
Yeah.
follow through. Once they make their selection, we will guarantee that they receive that option.
Cool. And Jennifer also said that she's had a lot of questions, but was just sending them to the attendees. So,
Oh,
Jafer,
oops.
if you want to copy and paste them back in, we'll certainly come back to questions for, I assume, for Vanessa.
Yes.
All right. Then, meanwhile, let's go on to memory.
Okay, so what I'm showing you here is the equipment that I built to do a memory task. So we're taking this a little step up in technology from pressing levers to responding on a touch screen, like an iPad. And of course, this is an experiment with monkeys, so we need to protect that touch screen, so we keep it behind a steel panel. And then down below, there's a little hole in the panel where the monkeys can reach in and earn their pellets. Now, an interesting little side story, the pellets that we used for these monkeys were sugar pellets, and they were raspberry flavored. Now, you might think a monkey should prefer a banana flavored pellet, but something that I learned from my applied friend here was that the importance of doing a preference assessment. So
You
when
had
I
a phone and applied friend moment?
did, and I
I'm
entered the
so proud.
monkey lab, they were using banana pellets, and I just anecdotally, it didn't look like the monkeys were that interested in the banana pellets. So I ordered some raspberry pellets to try some different variations and just did a paired preference assessment. I put my hands out. We repeated this multiple times. I switched sides. And monkeys overwhelmingly prefer a raspberry flavored pellet.
Very cool. So now all of you have a fun trivia fact when you are ready to allow someone that if you run a preference assessment, at least with Vanessa's monkeys, they prefer raspberries over bananas. Love it. Okay, so raspberry pellets are dropping in this situation.
Yes, raspberry pellets are the reinforcer here. Okay, so in this task, a stimulus is presented on the screen initially, and this is a chance for the monkey to sample the stimulus. So we require the monkey to respond 10 times to let us know that the monkey is paying attention to the stimulus. Then that first stimulus goes away, and there's a chance to make a comparison. Here, there's the original stimulus on the left and then a new stimulus on the right, and the position of those are counterbalanced in different trials. However, no matter what side it's on, if the monkey selects the original stimulus, it makes a match, then that's how they earn their reinforcer. If they select the wrong stimulus or the new stimulus, then that trial ends. So across the top of this slide, I've shown you the 3 steps in the trial. So there's the sampling component, there's a retention interval where there's no stimuli on the screen, and that's what's going to vary from trial to trial. And then there's the opportunity to match and earn the reinforcer.
When you say, can I ask you a clarification question?
Please.
When you say that the retention interval varies, you mean how long that is? So it could be really short or it could be really long.
Exactly. Thank you for clarifying that. So what we graph in this experiment is the percent of correct choices or correct matches, where 100% is they never miss one, and 50% is just chance responding because there's 2 stimuli. So it really doesn't get worse than 50% here. And we look at this across a series of retention intervals. So when there's no retention interval, when the 2 stimuli come up immediately, you can see that monkeys are really, really good at this game. Over 95% of the time, they're getting it right. But as we make
smart monkeys again.
Smart monkeys. They know their colors and their shapes. But if we make the game a little bit harder, so now they have to remember what the initial stimulus was, you can see that there's a steady decrease in percent correct choices. So they're doing worse and worse, and it's approaching that 50% value. Again, this is all under just baseline conditions, no interventions. But what we would do next is to try to identify conditions that might enhance memory, which would be shown to the right of this function, or impair memory, which would be shown to the left of this function. Researchers have generally been unsuccessful in finding treatments, medication treatments, I should say, that can improve memory. So that's sort of been a bit of an abandoned line of research. We no longer chase that. However, it is very important to know if any medications impair memory. So for example, if you're prescribed a medication, there might be a warning on it that says, do not take while operating machinery or driving or something like that. And those medications tend to impair memory.
Okay, I have lots of questions,
okay,
but
please.
I have one specific one. So you said that kind of looking for medications that would move it up to the green side, improve memory, has been kind of a fruitless search so far. Is there a difference between improving memory and preventing like decline in memory? Let's say that they're like aging process or other kind of I don't know the proper terminology, but any sort of diagnoses that would have a slow decline in memory?
That's a
Are there,
really good question.
is there
I
a
do have,
difference between improving versus like
yeah.
preventing decline? Does
Okay,
that make sense?
I don't have a direct answer to your question, but I do have an interesting story to tell about this.
Yeah.
The monkeys that were in this study, there were definitely individual differences that seemed to be based on age of the subject. So the oldest subject in this study was a little monkey named Cindy. And Cindy's function here was very steep compared to the other monkeys who were young, adolescents, in their prime. So yeah,
Wait, what steep means what? That
oh,
it goes
steep
down
means
quickly.
she sharply decreased and headed
Okay.
towards this impaired memory part of the
Okay.
graph.
Okay.
And
She was
so
old.
she was a little old lady, and while she could do the task just fine, she definitely had a different baseline compared to the other monkeys. So I think that
Interesting.
I didn't we didn't test ways to prevent this decline, but we did recognize this age-related decline.
Yeah. Is are there people who kind of study these tasks in humans looking at changes like longitudinal changes or anything?
I believe so, but I do think that it's underutilized. I mean, this is
Yeah.
very applicable. It's easy to set up. It's very
Yeah.
simple type of response that they can make. And yeah, I think it's underutilized.
Yeah. Okay, I kind of cut you off talking about the impaired side, but so you definitely want to make sure that if you're kind of testing the behavioral side effects of a medication, that you're
Mhm.
not, pushing it down into the red. But I see on the graph that the red only goes over to what, to like the retention interval of 4 seconds. What
Yes.
what would happen why doesn't it go all the way to zero, I guess, is my question.
A good observation. So any interventions that affect the matching at the when there's no retention interval or no delay would actually be separate from a memory impairment. It would be disrupted stimulus control so that even
Oh.
when there's no delay, there's no memory required, they can't really tell the difference between the shapes and the colors anymore.
Which would also be a really important behavioral side effect of a medication to know, I would assume, if it's disrupting stimulus control that powerfully.
Yes, exactly. So I would have to have another little red triangle there that said impaired stimulus control.
Gotcha. Okay, I understand that. Okay, I have another question about the move from monkeys to humans.
Sure.
So we see it. What did you call the curve? The curve, the
Oh, this is
decline?
a forgetting function.
Forgetting function. Okay, so we see the forgetting function all the way down to what, 32 seconds. So I may imagine after not too much longer, the monkeys are not remembering past 30 whatever seconds. What uh what's normal in humans? Do you know?
I
What
don't
like
know the values in humans, but certainly it must be longer than this. I can
yeah.
give you sort of a comparison with rats. Rats would require a shorter series
Okay.
of retention intervals before you
Yeah.
see an impairment, and humans probably require minutes, maybe on the level of hours. I'm not entirely sure there.
If there are any gerontologists in the crowd, or gerontology, as they say in other parts of the world, let us know in the chat if you know anything about the forgetting function and humans' retention intervals. Super cool. So more lines of research from Dr. Vanessa's lab. Was there anything else you wanted to say on this one before we get into some practical tips in our last 20 minutes?
I think I have said everything about this one. Yeah.
Okay.
Oh, I did
Um,
notice one question though.
yeah.
Um, there was a question about why they might prefer the raspberry pellet, maybe because it's novelty or closed economy. I can't say for sure why we didn't explore that further, but I do know it wasn't a closed economy. We did use those pellets as reinforcers for other behaviors, like if we needed them to present their paw at the cage. So I don't think it was just that it was within an experimental session.
Um, Speaking of monkey paws, what's behind you?
Oh, those are
Those are
Cindy's
monkey
paw
paws,
printed up
right?
there. Those are
Oh, Cindy.
eight monkeys that contributed to my postdoctoral research during the 4 years I was there. They became very near and dear to my heart. So I left with their paw print.
Oh, I love it. All right, folks, feel free again to put questions or comments into the chat as we come into the last section. So what we will be talking about now is practical tips. If we kind of whet your appetite, your applied behavior analyst who is now excited about basic research or was already but just wants to engage some more, or if you are a basic researcher here in the crowd with us and you're trying to encourage students or other applied behavior analysts that you know to engage more, here are some of the things that have worked for us over the years. So some practical tips. I was a little scared to start with this practical tip. Read basic research. I know that especially if you're working in a clinical setting, we're busy, right? We have a lot to do and maybe reading isn't on the top of that list, but really this is the best way is just to practice. So some recommendations starting with a topic that interest you. So, maybe don't just pick up the next issue of Journal of Applied Behavior Analysis and go to the first article that's there. Maybe you'll love it, but better, maybe search for some topics that are a clinical issue that you're having, or if you got interested about behavioral pharmacology or delay discounting or impulsivity, memory, start with those. I would also recommend not worrying about understanding all the procedures or all of the statistics. I know that I will only speak for myself, but I definitely do not understand every detail of the procedures in
That is
some basic
completely
research.
normal. There are some basic articles that I read and I don't understand all of the details. So don't let that discourage you. What's important is that you understand the overall purpose and goals of the study and their main findings and how the authors interpreted those findings. And sometimes you might read it and have a different interpretation, and that's okay too.
Yeah, I like that we have an honest bunch here. It's where we can confess things like not necessarily understanding all the procedures or statistics. We actually, Vanessa, if you're excited to get started, Vanessa has curated you a list. So Vanessa, you want to give some recommendations for some
Yes.
places to start if they were interested about today's topics?
Yes. No, one thing we didn't really have time to talk about today is how basic researchers balance the health of the organism with maintaining motivation for food reinforcement. So that's sort of what the first article talks about. And it's a very nice introductory. It's written really well as a little introduction to how we do food restriction and meal feeding versus free feeding or eating as much as they want all the time.
It's actually kind of just like about laboratory research in general, starting there.
Yes. And then I picked a review article for you on impulsivity. And it's published in the Journal of the Experimental Analysis of Behavior, but they bring in a lot of human-based examples. So I thought that that would be a good place to start if you want to learn more about impulsivity. And then finally, I picked one on memory since we just spoke about that as well. And this is an empirical article using pigeons. And they're also able to do this matching to sample behavior. And they have a really neat manipulation here is they actually trained the pigeons at different retention intervals and then compared their forgetting functions. And I won't give away the main point, but if you were interested in the memory stuff that I talked about, that would be a really cool place to start.
I can't believe you were describing JAB, EAB, basic research articles in a way that you like hiding the spoilers so that we want to go read these.
Yes.
So good places to start. I know that Dr. Michelle's putting our contact information. Certainly, if you want more, if you're trying to find something about a specific topic, you're also welcome to reach out and we can see what we can do to help direct you to a good intro article. The bottom line is we want to make sure that you just practice and you're not getting intimidated by the procedures, the statistics, kind of the finer points, when really the big points are the important takeaways. Anything else on reading?
No, I agree with everything you just said.
All right, so practical tip number 2. is attend basic research talks at conferences. So anyone who's here for CEUs, you probably also go to conferences for CEUs. Recommendation here would be to try attending what's called a single track conference, if you haven't heard of it. It's where basic and applied talks are interspersed throughout. That picture, the old prior to the glow up picture that you saw of Vanessa and me was actually, we were at CEABA, right? The Southeastern Association for Behavior Analysis. So a little confession here, Vanessa was presenting at that conference. I think you had a poster there. I was not presenting, so I didn't really have a reason to go. I thought it was just like, basic research talks, but I was like, well, I want to go with my friend. I'll go. And it was awesome. There were talks that were pretty simple for me to understand because it was about clinical work and applied work, but then also was a little bit of a reach for me because it was about basic research. But because the audience, everyone sitting in the audience has a mix, there are plenty of people that you can talk to about these topics. So I already had my basic bestie with me. It's a good place to meet people. If you're interested in this, we have no affiliation with the Southeastern Association for Behavior Analysis.
We're not on the program committee. We don't run this conference.
We're not plugging it because of that, but literally because I opened up to see what the program was, and it's coming up October 15th. It's online. So if you are pumped about basic research after this, you could actually attend online. Dr. Michelle put the link in the chat. I just pulled the morning session. There's an applied talk, there's a basic talk, and there's kind of an industry talk. So you can see everyone's sitting through the same things, and you're going to get to hear from basic researchers, applied researchers. It's looking like it's going to be a very cool conference. So
if you're
interested,
never disappoints.
Yeah, absolutely. So that's our recommendation for a single track conference where you're kind of forced to attend the basic talks. The other option, we'll talk about choice here. So at a multi-track conference, this is one of the conferences where you have multiple talks going on and you're looking through the program trying to figure out what to go to. Our recommendation here is to try attending symposia, panels, talks like that address topics from a basic, translational, and applied perspectives. So I'm going to fangirl for a moment here, but this was the best talk I ever went to at a ABAI, Association for Behavior Analysis Internationals, in 2014. My mind was blown. In this symposium, it was all about adjustment to change. So thinning schedules of reinforcement was a common theme. And they came at it from theory, basic research, clinical research, and organizational behavior management. So first, Dr. Annie Lital talked about theory and basic principles related to change. Then Dr. Stephanie Kincaid talked about research with pigeons in her lab. Dr. Kara Phillips talked about clinical research with individuals decreasing very challenging behavior and thinning reinforcement. And then Dr. Aubrey Daniels talked about organizational behavior management and thinning that schedule. So if you can browse your programs and look for talks like these, it's incredible. The next recommendation we have, I think, a couple more, and we'll see if we have some time for questions at the end. The next one is networking with basic researchers. So you got to the conference. What do you do next? Vanessa, do you like when people come talk to you?
Absolutely. Please do not be scared or intimidated. Basic researchers, I'm sure, just like applied researchers, love to talk about their experiments, love to talk about data they haven't published yet, love to talk about little stories about the animals in their lab. So please don't be shy.
And I found some of the good questions to get started with. If maybe you're a little intimidated by their procedures or their results, ask them about the clinical implications of their research, and what's the connection to kind of applied implications. Guarantee they've been thinking about it, and they're thinking about where they'd like to see that line of research go. The next option or recommendation we have for networking is to join special interest group. So for example, the Experimental Analysis of Human Behavior Special Interest Group, or SIG, they have a website that Dr. Michelle just put in the chat. So you can kind of browse that. You could kind of creep on it to begin with and then maybe join, but a good way to get introduced. The final one, I had no idea that academics spent so much time on Twitter, but they do. This is more Vanessa's world. So tell us about basic researchers on Twitter.
I joined Twitter because somebody told me that Twitter was hot for science. So there's a whole science academic Twitter. So I joined, and you can find all of those little discussions that I think you would normally overhear at conferences. People are just having those thoughts through their Twitter, and you can follow these threads, and they bring up lots of neat topics, maybe some that you can contribute to or some you just want to read about. And I highly recommend a couple of different people.
And we have some in the crowd, some on the panel. So these are some trustworthy basic researchers here. And I learned that you should put hashtag behavior Twitter, and that kind of gets you started.
Yes.
Okay. And we've got our very own Dr. Vanessa Minervini.
Matthew Bell, who I do not know personally, but the Twitter account is A+, and Dr. Derek Reed.
Shout out directly to Dr. Matthew Bell. And Dr. Derek Reed, also very trustworthy and does a lot of very cool connections of behavioral economics and bringing it out into the kind of real world application. So cool things to follow on Twitter if you just want to kind of watch before you join the conversation.
And Dr. Michelle dropped a good hashtag in the chat too. Hot for science. I like that.
Seriously?
Yes.
All right. So we will fly through our last slide to see if there are any questions. The final practical tip is a little bit of a soapbox, but it's advocating for basic research in university programs. So whether you're a prospective student all the way to faculty, there are ways that we can help to keep basic research in the curriculum. Prospective students, if you're thinking about grad school, when you're going for interviews or you're inquiring, ask about who's teaching basic concepts and principles courses, ask about EAB, ABA collaborations. Pro tip that will also make you look really good in your interview. So check out those. And if university programs are hearing these questions a lot, that's an indication of interest and need. Current students, actually register for the basic research EAB courses that are available. We want to have enrollment high in those courses. Volunteer in labs, people like Vanessa are always looking for research assistants, and collaborate, talk with, have those conversations with other faculty and students who do study basic research. Alumni, you have a very strong voice. Make your voice heard whenever possible. And if you happen to be, supervising people who are looking to go to school in ABA, make some recommendations about where they might be able to apply to graduate programs that have EAB faculty working at that university. And then finally, faculty, as much as you can, prioritize, advocate for hiring EAB faculty. And if you're lucky enough to have some basic researchers on your faculty, collaborate with your colleagues on research and teaching so that the students are able to see those interactions as well. But it really comes down to, find yourself a basic bestie. We're happy to have you join our conversation. We've saved you a seat, and we hope that after today you will feel more confident engaging with basic research and being part of that conversation. So that does wrap us up. So a couple of things. Dr. Michelle is going to start putting some links in the chat. The first one she put, let's see. So she has our email addresses, so you can email either of us directly. Our reference list is still there. The evaluation form, that is for you to tell us what you liked or didn't like about today's presentation. And if you have any, comments that you'd be happy for us to use on social media to spread the word about basic research. And the important one for anyone who is here for continuing education credits, those are BCBAs, BCBA-Ds, etc. That is that CEU form. That's what you're going to need to copy and paste into your browser to go to it, put your name and your certification number and the codes. Keep in mind that it may go to your spam, so please check your spam mail. Yes, Dr. Michelle just put it in again. Hey, Dr. Pam, I hope to see you too. Hopefully we can at conferences in real life this year. But Vanessa and I will stick around if people have questions or want to chat. Anything else, Vanessa?
There was a question for groups or people to follow on Facebook. Unfortunately, I do not use Facebook personally or professionally, so I'm not a good person to ask.
Jennifer, I know that link that we put in about the SIG, they have a private Facebook page. I can't vouch for that. I tried to go snoop on it before, but you have to request to be admitted into it, and I didn't have time to do that. So that might be a good place to start. I can't vouch personally. Dr. Michelle, we also have ABA Middle East on Facebook, so you're welcome to join us in this conversation. Yeah, it's hard to manage a lot of social media.
I agree.
All right, that wraps it up. Dr. Michelle, is there anything else? Do we forget any of the housekeeping details? Anything else we need to do? Perfect. So that, I think the one that Michelle just put in is the link to ABA Middle East, right?
It is correct. Yeah, no, you've handled everything. So thank you so much. I just wanted to thank you both so much. And as you can see, praise coming through in the chat. It was absolutely fantastic. So well received. I look forward to seeing all your comments in the evaluation forms. Thank you so much, Dr. Sarah. Thank you so much, Dr. Vanessa. It really felt like we were having a lovely conveation.
Good.
I feel like I have a new basic bestie.
Yeah, so everyone's basic bestie now.
Yay! You're going to have us all running up to you now at conferences.
Excellent. I can't wait. This was so much fun. Thank you for having me.
Thank you. And thank you, Dr. Sarah. Honestly, it was just such an awesome presentation. So thank you both so much.
It was a very neat experience to be able to share some of what we've learned out there in the public, and to know that worldwide people are part of this conversation with us was really exciting. So thank you all. I can see all the comments in the chat and so many familiar names that I recognize. So I hope I get to see all of you soon and meet new friends that I haven't met yet.
New besties.
Yes.